is coming up in the next panel discussion. As you know, that can be done on site today, but there is a fee involved. You can find out more at the booth outside. As a matter of fact, you will be finding out a lot more about that test, okay? Now, cancer can feel unpredictable and frightening, but today we want to focus on what is within our control, which is understanding the risk, taking proactive steps, and using advances in screening and monitoring to protect our health earlier so that we can make informed decisions and have better outcomes. So to start the next panel, which is what increases cancer risk and what you can do about it, please join me to welcome my panelists up on stage. Mr. Gerard Wong, Principal Dietitian at Parkway Cancer Center. Dr. Tanuja Rajasekaran, Medical Oncologist, Parkway Cancer Center, and Dr. Tan Min Han, Medical Oncologist and Founder and CEO of Lucence. Let's give them a warm round of applause. All right, so if you've just joined us, you will see a QR code on the screen behind me, and for our online audiences, you should see one on your screen as well. If you want to answer questions later on, you can scan the QR code or you can ask in person. Let's get this started. First question. Let's see now, Dr. Tanuja, when people hear the word risk, many assume that it is something that they have no control over. But even with risks, there's different types of risks. Could you tell us the difference between inherited cancer risk as well as the modifiable ones?
Okay. So that's a great way to start. So we'll talk a little bit about inherited cancer risk first. So whenever we talk about inherited cancer risk, essentially what that means is that you may inherit genetic changes from your parents, right? And some of these genetic changes may increase your risk of cancer. And this is something that you cannot change, right? We cannot control who our parents are. Whatever that these inherited genetic changes, you can't control, right? But the good thing is that whenever we talk about inherited cancer risk, generally it only accounts for about 5 to 10% of the cancers that we see. The other thing the other risk that we talk about is modifiable risk factors. And when we talk about modifiable risk factors, these are things that are related to your lifestyle, to your environment, things that you can potentially control. And these risk factors account for a higher prevalence of the cancer incidences that we see. So things that we can control, like lifestyle risk, for example, smoking, right? Alcohol consumption, right? Your weight, how much you exercise, and exposure to UV radiation. So whenever we talk about modifiable risk factors, those are things that we can potentially change, and thus we can decrease our risk for cancer. When we talk about inherited risk from cancer, generally we are talking about, I'm sure some of you may have heard about the BRCA1 or BRCA2 mutation, right? So for example, if you have inherited those genetic mutation, chance of getting cancer is higher, but that does not mean that you cannot do anything about it.
Okay, you mentioned, Dr. Tan, feel free to jump in, and this is my follow-up question. You mentioned 5 to 10% of cancers are from inherited risk. Can you state for us what types of cancers are these?
Okay, generally whenever we talk about inherited cancers, the ones that that usually comes to mind is things like your breast, ovarian cancers, prostate cancers. So for example, whenever we talk, I think for those of you who know, the BRCA gene became very popular after Angelina Jolie spoke about it, right? So she had an inherited BRCA mutation, and that increases your risk of not only breast cancers, ovarian cancers, also increases the risk of pancreatic, prostate cancers, right? So these certain cancers are more genetically linked compared to other cancers.
Okay, so let me finish up this part by asking, are there simple ways to tell me whether I have an inherited risk or not?
Okay, I think the simplest way is, firstly, you should find out about your family history. So, for example, if you have a family history or you have multiple family members with a similar type of cancer or related cancers. So, for example, if I have a mother with breast cancer, auntie with breast cancers, or cousins with breast cancers or related cancers like breast, ovarian, prostate cancers, then alarm bells should start ringing. Oh, is there a possibility of this inherited mutation in the family? Other things that can warn you about such a thing is, for example, people in the family being diagnosed with cancer at an early age. Whenever we talk about early age, we generally refer to age below 50. Right, or someone or multiple cancers occurring in one person. So if you have a person who has gotten breast cancer, ovarian cancer, or pancreatic cancer, in multiple cancers in a person, then it gets you thinking: is there a genetic predisposition?
I see. You mentioned 50 as a benchmark. Specifically, why 50?
Generally, this is what we use in international guidelines, where we say anyone below the age of 50, we generally call it young onset cancer, and so it's not, cancer is generally a disease of the older people. But recently, I'm sure you've read in the papers where you see there's an increasing incidence of cancer in the young, right? And so whenever we talk about cancer incidence in the young, we are usually referring to patients below the age of 50 being diagnosed with cancer.
Okay. Dr. Tan, you want to jump in?
So I think that's a really great summary of the challenges around cancer onset. And I think genetics certainly loads the gun. But environment, and that includes our diet, our lifestyle habits, that really is what also pulls the trigger, right? So I think this is something that all of us care about. And, I'm an oncologist by background training. I used to see many patients at, the late stage of their care at the National Cancer Center, together with Dr. Tanuja. I think we recognize that's not what we want to see at the end of care, and there always must be better approaches towards, treating, preventing cancer. And I think we are all here today to sort of discuss and share the experience. I think with the genetics part of things, and there is, of course, also environment, and some of these micro habits, whether smoking, whether diet, exercise is a major and very important part of prevention, because obviously this also goes through the problem of obesity, and weight. Being overweight is a major risk factor for cancer. That said, I want to give everyone also a sense of that obviously there are things we can do to control, not just obviously cancer onset, but also, of course, cancer progression. And exercise is, of course, one of the most important factors around that can fight cancer.
How many of you in this room, hand on your heart, how many of you can say that I do enough exercise for my age group? Show of hands.
Wow, we have a very active audience.
Not even half. Now we do the next experiment. How many of you think that you try? Wow, like this cannot. Because I also try very hard. But that's the whole point, isn't it? I mean, we have to try to begin with, which brings me to another point. I'm very naggy, okay? I know that I bring down the average age in this group, but I don't see too many young people in this group. So please go and share what you learned today, or at least refer them to the Mount Elizabeth Hospital's website so that they can see the correct information, okay? I don't want 一传十，十传百，十传百, then all become everywhere already. 好不好? Okay, now let's get back to...
I think when we talk about physical activity,
yes.
the conversation has moved from getting people to exercise more. I think it's about when people plan to exercise, they often fail.
Oh.
When you say, I'm going to spend an hour in the gym, then if work gets in the way, the kids needs picking up. So try to focus on the incidentals that you could do. I give you an example. It takes me 800 meters to walk to the MRT. If I take the bus, it's a one bus stop. It takes me longer. So by walking to the MRT to and back, I've done 1.6 kilometers a day. The clinic's on the 10th floor. if I walk up the first 5 floors, by the time I reach the 5th floor, half the load has gone. I'm taking the next 5 floors up. So you end up having to do it without you thinking about it. When you plan to do it, sometimes you often miss doing it.
I see. So my takeaway is don't plan, is it? It gets slightly confusing, but I do take your point. I have to say, sometimes, when we find parking lots, people say park close to the lift. Actually, I park further away. Because then I walk, I actually do think that every step counts, but I carry the umbrella, which is very auntie. Okay, Gerard, let's stay on you. If there is one thing that people across all age groups can do when it comes to their diets to control or manage their risks, what would it be?
I think when you look at the World Cancer Research Foundation, which compiles, all the major studies, and they say that 30% of cancer can be prevented by modifier risk factors. The WHO came out this year in February, January, and reposted by the Straits Times that up to 40% they felt can be prevented by modifiable risk factors. I think when we look at the guidelines, it is not something that is rocket science, but implementing it is harder. Having a healthy body weight, being losing weight, eating healthy, cutting back on your processed meat, red meat, having more plant-based foods. These are things that people know. But doing it is different. I'll give you an example. When we talk about cancer risk, it starts early in childhood. People say that you are what you eat, and I often say that your child is what you eat. Okay, what I mean by that? So when my kids grew up, and it sort of etched in my brain because it left a lasting memory. When I brought them out for the first few times, my girl came up to me and she said, "Hey, Daddy," and people have heard me say this joke before, "Daddy, why is the rice outside brown, white color?" Because they've never seen white rice. Because at home, there is no other choice except brown rice, and they grew up with that. So I think healthy nutrition, good nutrition, starts off early on in childhood when you set the groundwork for later on in life.
Okay, so let me push it a little bit further. Is there one, we hear a lot about lifestyle changes, you need to eat healthy, yada, yada, yada. Is there one modifiable risk that everyone can control, but it is either misunderstood or very little known?
Okay, if there's one tip I could give people, I often ask them to see if they could eat fairly unprocessed. Okay, what I mean by that, okay, if you ate a fish ball or you ate a nugget, you don't know where the meat comes from. You don't know which part of it comes from. If you ate vegetables, you can see it's vegetables. If you ate, fillet of fish or, chicken, that you can actually see the meat. You think it's very easy, but it's actually not that easy because to do that, it means that you probably have to cook a little bit more often at home.
Okay, and that's not easy, right?
And that's never easy.
Okay, those of you who have watched my canteen bento episode will know that I asked this question. Can we have cheat days?
Certainly, I think it's all right to have cheat days. If you have done it, well for 5 days of the week, having 1 or 2 cheat days is fine. And I had another patient of mine, he was doing his treatment and he got married and he was very anxious. He came up to me, "Hey, Gerard, I got married today. Can I drink 1 glass of wine?" I said, well, the guidelines say no, but it's a happy day. It's about lifetime. I say, go for it. Have that glass of wine. Yeah.
Okay, got it. Now, we all know of someone, or at least we've heard of someone, who's done all the right things. Exercise, eat right, super intelligent, pumping away all the time, and then gets diagnosed with cancer. Dr. Tan, I want to ask you, in that context, how are innovations like the multi-cancer early detection screening changing what it really means to catch cancer early?
So absolutely, you're absolutely right to point that out, Diana, because the reality here is we have talked about the genetics, where you see a strong family history, and about 1 in 2 out of 10 folks, you have seen, as Gerard has mentioned, the 40% of cancers that are managed by modifiable risk factors. But it still does go back to the fact that what about the remaining 50 to 60% of cancers that remain unexplained, for which there is no clear sense of an explanation other than bad luck? And bad luck is, more along the lines that we don't actually fully understand what's going on, right? And If prevention is not something that's going to be possible, then obviously we hope for the earlier detection of this, ideally before symptoms, when treatment can lead to better outcomes. And I think for myself as a physician, and I thought it would be really important to, as when we were developing technology in my lab in A-Star, to focus on that detection of cancer as early as possible, and ideally as non-invasively as possible, in a convenient way, because we know today that the problems why people don't necessarily adopt screening, I think that's firstly because of convenience and the sense of pain and fear about whether a colonoscopy or something else. I think there is that first concern, but also there was a need to make sure that people could overcome that sense of how should I put this? The sense of what it's a fear, and let's not, cancer is a scary word for everyone, right? And all of us have been touched in our lives in some way or another. So I think the development of multi-cancer screening was directly to address this, that we know today that for 7 in 10 cancers, the best advice from the conventional recommendations is to wait for symptoms and to see a doctor. Right? I recognize this is a problem, and I think this is why, Diana, I thought this, we wanted to build technology to help solve that problem.
How is your technology helping to solve that problem?
It's really about the fact that cancer in its early stages begins to leak some of its DNA fragments into blood, and using technology that allows for that blood, those cancer mutated fragments to be detected in a blood test, the cancer fragments get picked up and reported in a result, so that the whole idea here is that the blood test can pick up the signals across multiple cancers in that blood draw. Yeah.
Okay.
Dan,
yes.
can I just jump in here? You were just speaking about the example where someone is super fit and does everything right and then gets cancer. And not too long ago, I saw this gentleman in my clinic, right? So he's a 27-year-old. I call him boy, but he's not. He's a man, SAF regular, as fit as can be. He runs 10 kilometers every other day. He's muscular. Doesn't drink, doesn't smoke. He's the sort of guy that you would see in the high rocks competitions. And he was recently diagnosed with stage 4 lung cancer, right? And this is a gentleman who has never even smoked a cigarette in his life. So, and I think, what that I want to bring forward is, whenever we are young, we think we are invincible. Right, we ignore some of the symptoms that come up. So especially after I've chatted with him for a while, right? So he says he's been actually having this on and off cough, right? That he didn't really think very much about, and it was happening for the last year. Right. So I think, as what Minhan says, of course there's some cases where you don't have any symptoms, but I think if there's any sort of persistent symptoms that you have, no matter what you think your risk is, right? If you are a runner, a marathoner, you don't drink, you don't smoke, but if there's any persistent symptoms, I think you should do due diligence to get it checked, because there's nothing to lose from that, really. Yeah, yep. And in my clinic, I've really seen so many of these people who've come in below the age of 40 with breast cancer, with lung cancer, and these are people that high flyers, don't smoke and exercise, and cancer has happened to them. So I would say, of course, keep up to date with your screenings, but I think symptoms, no matter how small, if it's persistent, definitely please go and get it checked out.
Okay, so like Dr. Tan had mentioned earlier, if you can't prevent it, at least early detection so that you can do something about it. I want to talk about specifically how that test that you have works. But before that, I want to ask you, how many of you know of someone or yourself who says, I think better don't know lah? Because if I don't know, then I'm not scared to death and I won't have to do anything about it. How many of you know someone like this? Right? I'm surprised there are not so many hands because I hear it so often. There are people like this, but there are clearly advantages to early detection because I imagine that the intervention may be less costly at a more initial stage, at least, compared to a later stage. So, Dr. Tan, take me through very simply, how does that simple blood test for your test works?
So the test that we developed, Lucen's Insight, begins from having the individual see, of course, a physician where a family history, a history around risk factors is taken. I think informed consent is performed, and a blood test is drawn. I think that test is processed at our lab, and in this test, over the signals, the signals of cancer are searched for, and if found, that is reported. And most of the time, over 90% of the time, because most folks going for screening are healthy, the result is negative, and that is therefore of reassurance to the individual. The test itself takes approximately 2 to 3 weeks to be returned to the patient, to the individual, and over this, and there is of course a range of options in terms of everyone has a sense of personalization, right? Because I might have a relative with a certain cancer I'm worried about, so people will have a certain a choice of the range of cancers that they are interested in screening for. And subsequently, I think following that, the advice will be given to the individual, obviously to carry on screening, conventional screening, and that's very important that everyone remains up to date with their screening as well as the recommendations. And together with that, I think the results of the multi-cancer screening test provide additional reassurance, and that would be the overall experience of this.
Okay. Dr. Tanuja, I'll come to you in a bit to help me contextualize this test compared to the other types of screenings that we already do. So specific to this test, what I've learned is that it's minimally invasive. Two very important questions that I'm sure are on your minds. One, how much is it? Two, how accurate is it?
Absolutely. I think these are the two most important questions. I think firstly we'll begin with the cost, and there is a range of obviously tiers depending on the interest, and I think the focus of our goal is to make sure that this is obviously going to solve the biggest range of top cancers and something that's affordable, and we have a core panel that will cover over 50% of cancer mortality, and this is certainly at a price between around $600. So we do have additional options for people who do want extended ranges beyond the top cancers, and I think that's obviously something we want to make sure a broad range of folks have access and for these services. For the accuracy, we report sensitivity and specificities that we have a specificity of 99% that is reported. That means very low false positives. In terms of false negatives, we typically report a sensitivity of 81%, and that typically means out of 10 cancers, 8 are picked up and 2 are missed. How we see the situation today is that many of these individuals would not otherwise have had their cancers detected, and therefore having the 8 in 10 detected is certainly something much better than having them missed. So this is where the accuracy part for the patients is really important, that this discussion happen together with the doctors.
So, Dr. Tanuja, in this case, when do you order such a test, for example, and also how does it fit into the conventional types of screening?
Okay, so whenever it comes to the conventional screening, as part of our national screening guidelines, we screen for breast cancer. So women above the age of 40 are encouraged to go for your yearly mammograms, and you can do this at the polyclinic, and it's readily available. You have the mammo bus. I think you even have one outside here. So that is standard. And then for cervical cancers, right? So that is part of our national screening program as well. We encourage all women who've been sexually active to go for a pap smear. Together with the pap smear, now we do testing for the human papilloma virus and also for colon cancer, right? It's encouraged that anyone above the age of 50 should go for a colonoscopy at least. But what about all the other cancers? So generally for the patients who come to me, I would say, please make sure you go and get these standard screening tests done, right? I think there is no discussion, no negotiations about it, unless for some particular reason you tell me I cannot go for this test. But then let's say if you tell me that, hey, I have a family history of NPC or nasopharyngeal cancer or liver cancer, that's not part of our standard screening guidelines. And if let's say you want something additional, then I of course discuss with them with regards to the multi-cancer early detection tests. Right. So in my case, for my patients, I say still go for your regular screening program that's recommended. And if you can afford it, and if this is something that it's something that you want to know, if you have additional risks, definitely consider the multi-cancer early detection as well. That's where I look at it from my standpoint.
Okay, so for now, it is not something that doctors or oncologists regularly say, okay, let's go and see Dr. Tan and get this test done. It is a case-by-case basis, and even if the test were to come up positive, the patient then has to go on to do more specific tests or screening to determine if there is infected cancer, what type of cancer it is. Is that correct?
Yes.
Yes. So this is so absolutely correct that this is something that I think physicians around Singapore through either Parkway Cancer Centre or Parkway Shenton, these are where these multi-cancer screening tests are made available. And I think absolutely these discussions about each individual's risk need to be taken. I think that's where today's topic about genetic risk, family history, environmental or dietary habits, that's really important.
Yeah. I think suffice to say that my takeaway is that advanced types of screening today enables early detection faster, sooner. Well, we may not be thinking about it now. I mean, I don't wake up in the morning and say, oh, today I'm very free, let's go for advanced cancer screening. So, but keep your eye on the ball. That's what we like to say. Keep a lookout for news so you know what's happening, and you can, in future, hopefully you won't need it, but someone else may need the advice that you have, right? Gerard, I want to come to you. Let's say that if someone discovers that they have a higher genetic risk of cancer, how might that influence dietary advice?
I think certain cancers, there's a dietary play to it, and certain cancers that aren't. Let's say, for example, we find that they have a predisposition for colorectal cancer, for example. Then we know that, perhaps cutting back on their processed meats, increasing their fiber intake, making sure they have, good bowel movements, all that we know plays a role in perhaps reducing the risk factors. Whereas if they have a genetic predisposition for breast cancer, maybe liver cancer or pancreatic cancer, there might be less of a dietary modification to sort of prevent it. So it really depends on the cancer sites.
So the only way to know is to speak to a dietitian like yourself, or how does it work?
Yeah, I think if they know they have a predisposition towards cancer, it depends on the cancer site, and then we can say, if there's a dietary element that we could do to modify to help prevent it. If not, then maybe there's less of a dietary component to it.
Okay, got it. Okay, the all-important question, because I don't have the money to buy it, what about organic food?
I think with organic food, that's a tough one, because when you talk about organic food, there isn't really studies to say whether it's pros or cons. The other thing is the policing of it. Singapore in itself is a country that imports a lot of food. And food from different countries have different legislation or regulations around the term organic. Even things like olive oil, for example. The two terms used commonly, cold pressed, extra virgin, can be used interchangeably in different countries to mean different things. So I think that's one thing that's hard to know exactly. If cost is not an issue to the patient, I said, go for it. But people then ask me, so do you buy organic? So I'll say to them, well, I would buy organic meats, but I tend not to buy organic vegetables. Then I say, why? So I say, well, when I'm paying for something, I want to know that there's a difference. When you buy organic meat and when you cook it, there's a taste difference, and the amount of liquid that comes out of it is different if you actually buy it and cook it. But when you organic vegetables, yes, there might be different or less pesticides, but you don't really know it. And I just believe that in Singapore, the HSA does its job, that everything imported is safe for Singaporeans' consumption. So if you ask me, if I want to spend my money, I'll spend it on organic meats rather than organic vegetables. Okay. But there's no right or wrong.
Of course. And it's always also a question of balance. I mean, I might spend 90% of my budget on organic food, and then the 10% every day eat fishball and ham. I mean, I imagine that it's going to cancel out all the benefits, right? Okay, so I want to ask Dr. Tanuja, for a healthy person, and I know you've touched on some of this point earlier on, but I think it bears repeating. For a healthy person, what are the indicators that may suggest they have a higher risk of cancer, and when should they consider further assessment?
Okay, so I think it starts off first is know your family history. Right, I think we touched a bit on that. So if you have family members with a similar type of cancer or related cancers, breast cancers, ovarian cancers, definitely you may be at a higher risk, or family members being diagnosed with cancer at an early age, or so family history, number one. Number two is know your own medical history, right? So for example, if I'm a hepatitis B carrier, right, that increases my risk of liver cancer. Right? So if I'm a hepatitis B carrier, I should be on follow-up with a doctor to go for regular scans to make sure that if let's say if I'm going to develop liver cancer, at least I want it to be detected at an early stage, not at a later stage, right? If you have gone for a pap smear and someone has told you that we have detected the human papilloma virus, then you know you're going to be at higher risk of cervical cancer. So then you need more closer follow-up with your gynae. So secondly, know your own risk, right? Then the third thing is lifestyle factors, right? So if you're a smoker, I think there's enough information out there to tell you that you really should stop smoking, right? And alcohol consumption, right? So decrease alcohol consumption, stop if you can, stop smoking. We know about maintaining a healthy weight, so make sure you get in your exercise, right? Environmental risks, if you especially for the white people where the higher risk of skin cancers, you want to make sure that if you're going out in the sun, you want to have adequate UV protection, use your sunblock. So the third thing is your lifestyle and environmental factors, those things that you can control. And lastly would be symptoms, right? That we touched on, right? I think the key word is persistence. So my cancer patients always, those patients who finish their treatment under surveillance, and they always ask me, doctor, how do I know that, this shoulder pain that I have here, this is not cancer related? How do I know that it didn't mean that the cancer has spread to the bone? How do I know this? So my answer is always persistence, right? It's very common for sometimes, you wake up, you have a little bit of pain, aches here and there, but usually they go away. But pain, anything that's related to cancer, usually it does not go away until you do something about it, right? So if you have a symptom that is persistent, not going away, a new lump that has developed, definitely go get it checked. Yeah.
Thank you. So I just want to wrap this one up very quickly before I come to you again, Dr. Tan. There's a lot of information out there, but I would really caution against being Dr. Google. Right? Firstly, it's quite frightening because everyone is a Dr. Google these days. And secondly, be a good patient. I came across this term when I was having 3 babies in a row and I didn't sleep for 7 years. My doctor says, you're fine, you are a very good patient, you listen to what I say. So be a good patient as well, because it's a partnership where you have to work together with your healthcare team, okay? So back to the last question on early detection, Dr. Tan. Looking ahead, do you see multi-cancer early detection tests evolving? And what does this mean for how we screen for cancer in the future?
So I think the most important point in the entire approach to early detection is to make this more accessible and more useful to people. And I think if there was one message I wanted to convey, it really is the fact that cancer is detectable in blood, right? And I think we experience this first in symptoms. We can use CT scans or radiology to measure it, but right now, cancer is detectable in blood. And it is not through, you may have heard of protein tumor markers, CEA, CA99. These are, if you can consider this, a very early first generation type approaches. And today, now, if there is that message, and it's not only for healthy people, it is for people who have cancer, who are monitoring themselves for relapse, who are looking for therapies, that it is detectable in blood. And I think the technologies are here, they are growing, they're evolving, and they're going to make cancer care much better and much more accessible. And possibly we see that vision where this care is going to be available at home. And because this is all about empowering the patient with a better experience.
Okay, we look forward to that future. So, ladies and gentlemen, I have 10 seconds left on the clock, which means that by the time I finish my statement, we will be taking questions. Yes, sir. So I've got a couple of questions on Slido. I might go to that later. But, sir, please go ahead. I've got a mic behind you.
Thank you. My name's Graham. It sounds from what you guys are saying, we need to choose our parents pretty well.
Did you say insurance?
No, we need to choose our parents very carefully.
I feel sorry for my kids.
My question, two things. One, Dr. Tan, that this blood test, does it just identify a sleeping giant that we hope never wakes up, or is it a definitive answer to say that, yes, you will develop one of these type of cancers? Second question is, most of the cancers have symptoms, but as you've heard, pancreatic is like mostly asymptomatic. Can that be picked up with your blood test? Thank you.
Thank you, Graham.
So I think cancer does grow over time at a certain speed. We see cancer grow, from 1 centimeter all the way to a point where it has symptoms. So it is a silent threat for the first part of its, existence. And this is the whole idea. You want to pick it up before those symptoms. And if this is located in a place that's inconveniently, not that it's hard to access, such as the liver, such as the lung, symptoms won't appear until the cancer is relatively advanced. So the whole idea of these tests is to pick this up.
So can I just jump in really quickly? So when we talk about early detection, it means that even there's no symptom for sure. That's why we call it early detection, right? But that means the minutest, the smallest cancer cells are already present, and these early detection tests will be able to find it out.
So typically, these early detection tests will pick up cancers at about 1 centimeter and up. So what that means is that depending on where these are located, whether in the lung, whether in the liver, these are often prior to the onset of symptoms.
Okay. Mm-hmm. Okay. And the second question was about pancreatic cancer. Would you take that quickly?
Very similarly, actually, for pancreatic cancer, which is obviously a deadly disease located in an area that's inaccessible, we generally do want to detect this as early as possible, ideally before symptoms.
Okay, next question. I saw a hand. Yes, sorry. That one first, okay? I do have a bit of time, so let's try to get through the question. Yes, please. Go ahead, madam.
Okay. You have said a lot of cancer tests. Okay, cancer markers. And then there is this protein test. There's two different tests. And what about FIT test, F-I-T?
So, madam, you want to know the differences between them?
Yes.
Thank you very much. Okay, Dr. Tan?
So The FIT test is a stool test that is used for screening. So I think that's an important part of the national screening program. For the protein tumor marker tests, these are blood tests that are quite regularly performed. They come with their own performance in terms of specificity and sensitivity. I think physicians commonly do use them today, and these come also with their own set of limitations. Maybe I can invite Dr. Tanuja to share her experience with the tumor markers.
Yeah, so I think to just summarize very quickly, the tumor markers generally, the ones that we talk about, the CA99, CA125 that you may get it done at the GP, it is technically not meant to be diagnostic tests, right? It is actually used by us oncologists to trend how a patient, for example, a patient who has ovarian cancer, how the cancer is responding to treatment. But sometimes this has been used as diagnostic tests, but they are not meant to be used as diagnostic tests because they are not very sensitive, because there are many non-cancerous conditions that can cause these protein markers to be raised. Dr. Tan's test is different. The multi-cancer early detection is looking specifically for circulating tumor DNA in the blood. It is not a random protein test, right? So those two things are completely different.
So before I take any more questions from the crowd, I will piggyback on what you have just said, because we have one question on Slido that asks, so then what is the difference between the blood test that Dr. Tan has been talking about and DNA genetic test for cancer detection?
Okay, so we are going into a little bit more technicalities, but when we are talking about, if let's say, for example, if I have a mother who has breast cancer diagnosed at the age of 30, I'm going to be at very high risk, so I want to check whether I have an inherited DNA mutation. So that is looking at all the blood cell, my blood cells in my body to see, this is a germline DNA test, meaning that if I've inherited a mutation, all the cells in my body should carry that mutation. Okay, that is the genetic test. Dr. Tan's test is looking for tumor DNA. So that is only going to be present if I have a cancer that is there. So for example, if I have a lung tumor and is secreting this tumor DNA, then Dr. Tan's test will pick it up. Okay, but anybody in this room can go for this genetic test to see what your genetic risk is, because we are looking at your own normal blood test. We are looking at your normal blood cells to see whether you have an inherited DNA mutation. I hope that answers the question.
Yep, thanks for that. Do we have a question from the floor? Anyone? Sir, I'll come to you in a minute. Can we give the mic to the gentleman? I ask that you keep your questions short in the interest of time.
How affordable is the management and treatment of cancer in Singapore? How affordable?
How affordable is the treatment and management of cancer in Singapore? That is a big question.
Yeah, that's a very big question. I think we were in a very broad sense. Okay, I would say that if you are diagnosed with cancer in Singapore, there wouldn't be a case where you would not be able to afford treatment, because you can go to the restructured hospitals, and of course, if you can afford it, you can obviously. You have the private healthcare system, right? And I think cancer costs really varies on the type of cancer, the stage of cancer, the type of treatment that you are going to receive.
So what I can say is look out for the next panel discussion, sir, because we are talking about insurance and managing the financial part of it. But from working on this story or working on this forum, I have heard many spokespersons and stakeholders talk about how if you have cancer in Singapore, I don't think there will be a situation where you totally cannot be treated because there's no money. Right? I have got friends who ask me, my Malaysian friends, right? They say, what is cheap in Singapore? I was like, okay, I don't know. Well, my answer to them was, well, education is very affordable. Can you beat that? But I think healthcare, we do have a safety net. And I believe, okay, that the system will catch you. So no worries about that. Sir, you would like to ask a question.
Yeah, you have talked about diet, you talk about, drinking, smoking and stuff like that. How about mental health? If you are always worrying about life, always worrying that somebody is stealing your money, you are a CEO, you want to retire, but you don't know whether someone is backstabbing you, does that generate very bad cells, like make your cell deteriorate and then in the end you get cancer? Because it's something that I think...
No, thank you, sir. Thank you for that question. Because when I heard it, I was like, that is a crazy question, lah. But then again, it's a fair question because sometimes when I go and see the doctor says you're very stressed, is it? Right? So it's a fair question. What would you all say? Gerard, feel free to jump in as well.
I mean, it's a tough one because you can't really measure it. And suddenly, we've all, I've done heart disease for the past 10 years. And again, patients with no risk factors, healthy, fit. And when he came back with a triple bypass and he said, I think my work and my stress caused my heart attack. So it's a valid point. It's just that it's hard to quantify.
Yeah, I would just jump in very quickly. I think we know that inflammation, right, inflammation increases the risk of cancer, right? And there has been studies that show that stress increases the risk of inflammation potentially, right? As Gerard said, you can't quantify it, but if there's a way to decrease your stress, then definitely do it.
Okay, if I don't have any more questions, I've got 25 seconds, this is interesting to me. To the dietitian, do you recommend TCM for cancer patients or survivors?
I think, there are often two schools of thought, and I give this example because in a Western medical model, we don't believe that you can't eat prawns after surgery. And after surgery, we say, I can't eat prawns, it causes inflammation, and then the hospital serves like lobster porridge, and that's what people really go for when they go to the hospital. So I think there's nothing wrong if it's complementary. I think when people do come for treatment, the only thing is that I often advise them not to do the pills and the potions because we don't know the active ingredient, we don't know the interactions with the chemo drug. So after the treatment, they're a survivor and they're doing it complementary with mainstream medicine, there's no issues with it. Yeah.
Yep, I think we've come a long way with that sort of coexistence as well. I mean, if asked this 10 or 20 years ago, the answer might have been quite different. So to sum it up, ladies and gentlemen, I want to say that your choices matter. Healthy diet, lifestyle habits play a meaningful role in reducing cancer risk regardless of background. And detect early, live better. Early detection through advanced screening enables earlier intervention, better outcomes, and greater peace of mind. On that note, I ask you to help me to thank our panelists today. Thank you. Thank you, Gerard, Dr. Tanuja, and Dr. Tan. I'd like to invite you to take a rest off stage.